Hi, I'm Mary Bacon from Pregnant Fit and Fabulous, and welcome to my YouTube channel. Every video that I do, I want to start off with being grateful for something. And today I'm being grateful for you watching this video and getting educated on all pregnancy tips and also lifestyle, but also parenting. In today's video, I want to talk about avoiding abdominal separation and also stretch marks. I have them and so many other mums do too. So I will show you mine towards the end of this video. So stay tuned for that. So when I train mums how to be strong, healthy and have a fit and safe pregnancy, they always ask me what abdominal exercises can I do and how can I avoid this abdominal separation. And I have to say, I have 100% success rate with women not having the abdominals separate. I mean, of course they're going to separate because the baby is going to grow and the rectus abdominals or your six-pack muscles are going to separate naturally. But they're going to go back in no time. In fact, when your physiotherapist or your medical support person tests the abdominal separation after the delivery, you should have maybe about 1 to 2 centimeters separate, like in your belly button area. So I constantly get text messages from my clients saying, "Hey, I breezed through the physio class, and the nurse or the midwife told me that I have no abdominal separation." So this is like amazing news for my mums and also for me, because it makes me feel like I'm contributing in a major way. So let's talk about those core muscles. And I think that a lot of mums maybe not understand what goes on within the core muscles, and I've got some images here to show you. So the first one I want to show you is this image here. It actually comes from a lady from Kansas City, and it's Empower Your Pelvis. So look her up on Instagram. So if I want to show you this six-pack muscle, that's where your abdominal muscle separates. So these two muscles will separate. And then you've got the external and internal obliques. And then deep in there, you've got your transverse abdominals. But not only that, which way do we go? Here we go. You've got this muscle here that is not really talked about. It's called the multifidus muscle. And the only time that the multifidus muscle contracts is when you contract your pelvic floor muscles. And the other thing that happens is that many mums are not aware of, and maybe your doctor doesn't have enough time to explain these things to you. So you come to somebody like me who is going to teach you things like that. So your diaphragm and your pelvic floor muscles work together. So when you do a big diaphragmatic breath in and then you breathe out, the function of your diaphragm is finished. Straight away, then you lift your pelvic floor muscles up and you contract that. When you contract your pelvic floor muscles, that multifidus muscle, this one here, will actually contract. So as far as avoiding back pain and having a strong back, you really need to consider what core muscles you are activating and what exercises are going to give you that. So in another video, I'll show you what you can do to avoid that abdominal separation. But first of all, I want to teach you things that need to be layered progressively and how these abdominal muscles all work. So you need to really strengthen the pelvic floor muscles, your transverse abdominals, which is like your belt-like muscle around your waist. And then you've got all the other muscles on the external of your body. So your external obliques, and then your six-pack muscle. They're not part of your core, but they're your top muscles there. So you really need to be careful what to do there. So really doing things gradually is the key. So if you haven't done a lot of exercise in the past, you really need to start off slowly and doing something like lying down on your back with your knees bent, having your hand directly underneath your belly button area, and just mildly squashing your hand and just feeling the tummy contracting a little bit and lifting your pelvic floor muscles. So that's kind of like your basic stuff that you can do. Then the other way to do it is contracting your pelvic floor muscles, tighten up your transverse, and then leg lowerings one at a time, and just making maybe small movements and avoiding the lower back arching. Side hovers, planks, they all work. I mean, I'd rather you do something than nothing, but you've just got to concentrate on doing the right contraction for the right muscle. And remember that multifidus muscle. If you need to go to a pelvic floor specialist, you can also go and get your transverse and your pelvic floor tested by having an ultrasound, much like you would for your baby, and just to see the growth and when they do all that measuring stuff. So I have a couple of people in Sydney that I refer my clients to go to, but I also use biofeedback tool like the blood pressure cuff, and it shows me where the mum is with her pelvic floor muscles. So none of my mums have abdominal separation. I'm so excited about it, and I have lots of content to share with you. So make sure you subscribe and you click on the bell so that you never miss a notification of my videos. So stretch marks. Oh my goodness. Well, let me just show you mine, because I know there's a lot of mums who go, oh, you know, they're horrible and what to do. So anyway, we'll see how we go here. So these are my stretch marks. I don't know if you can see them, but they're not very nice. And I have had them, and also they appeared in my first pregnancy when I was 1 week overdue, and they kept on popping. So I've got them on my side, and then I've got them on the belly there. So you can't avoid them. And it is hereditary. So my mum had massive stretch marks, but she was also overweight. So that doesn't help either, because you've got, you know, the skin that just stretches, and then you've got stretch marks, and yeah, it just doesn't feel good for your self-esteem and your confidence. And then my daughter also, with her first pregnancy, Stephanie, she had a 9-pound baby, and she's smaller than me, so her stomach was quite large, and she's still got those stretch marks. And I don't know that there's a lot of stuff that you can do. I was rubbing bio oil on that, and obviously, you know, it didn't work for me. Other mums swear by it. So find something that's going to help you to keep your skin hydrated or lubricated, and you know, keep asking around and see what works for you. But for me, it just didn't work, and I'm okay with that. Like I'm happy with my stretch marks. I'm happy with my tummy, and it doesn't mess up my head. But if it does make you feel, you know, uncomfortable and not confident, just wear the appropriate clothes and know that you gave birth to a beautiful, healthy baby, and that is the result of your stretch marks. So until next time, write in the comment below what you would like to hear, or email me on my email, which is info@pregnantfitandfabulous.com. Follow us on Facebook and Instagram, and we'll be happy to answer any of your questions. And also every Monday I do Facebook Live at 1 o'clock Sydney time, so be sure to join us for that. Until then, stay happy, healthy, and avoid that abdominal separation by doing various abdominal work. Until then, bye.